Alright, today we're going to be applying the toe loops for use in treatment of fractured toes. Typically with a fractured toe we're not going to go to surgery, we're just going to stabilize the toe. And the way we're going to do that is we're going to use one of these little toe loops, which is this little guy with a little hole in the middle for the toe, or we're going to use coban, and I'll discuss when we use one or the other. If the physician asks you to use this, make sure that when you take it out of the bag there's a little piece of paper that sometimes is stuck between those two. Make sure that comes out so the patient doesn't feel that in their toes. And we're going to pick the toe that's injured. So in this case we'll pretend it's this third toe here. And what you'll do is you'll put this little guy around that toe, just like so. And you always want to put it around the toe that's injured because it will provide a little bit of compression for swelling as well. And then you gently wrap that around the adjacent toe, and there's a little Velcro closure on the side. Now if the patient doesn't like that, or in the case of the last toe where the last toe may be quite a bit shorter, what you can do as an alternative is you can actually use coban. Now we'll often use coban as well after surgery to keep the swelling down in a patient that's had hammer toes, so sometimes we'll ask you to wrap each toe individually with this. It's a very similar process. The only difference is when we do the toe fracture version, we're actually going to wrap it to the adjacent toe. So in this case you're going to start at the tip of the toe, and what you're going to do is gently lay the coban on and work your way back to the base of the toe. And at the same, the whole time make sure you're not causing any wrinkles to get formed in that. Once you've done that, you're going to wrap this to the toe next door to stabilize that toe. So when they walk, there's not as much motion. And you're just gently applying that. Don't put it really tight. If you start getting translucent with this tape, that means you're pulling too hard. And that's how you finish that. Now again, if you had done this for a hammer toe surgery, you would just individually wrap each toe with coban to keep the swelling down and advise the patient to change that daily. Same thing with the fracture taping with the coban. You would literally have them take that off at night. You wouldn't have them leave that on during the day. Same thing with the surgery. This guy as well. It's really just when you're walking to keep that motion down and also swelling after surgery. And that is the toe loop application and coban application for swelling or toe fracture.